Okay, I'm gonna show you guys how to change a dressing on your art line. So first thing we're gonna do is we're gonna perform hand hygiene. Then we're gonna take our central line dressing kit and we're gonna open it and remove the blue insert from the package. We're going to open the kit and we're gonna put a mask on ourselves and a mask on the patient if appropriate. Then you're gonna open up your kit and you're gonna put on this first pair of gloves. There's a drape in the kit that you can use to put underneath the site if possible, but you don't have to use it. So once your gloves are on, here's the drape that you would use if you need to. We're gonna remove the dressing. You wanna carefully remove the dressing by peeling it all off, and you wanna peel it towards the insertion site. And you wanna be careful when you do this so you don't pull out your art line. I always like to hold it while I'm pulling the dressing off. Okay, so once your dressing is off, you're gonna take off your gloves and you're gonna perform hand hygiene using the sanitizer that's inside the package. So once you perform hand hygiene, you're gonna lift up the second flap and you're gonna don your sterile gloves. Once you have your sterile gloves on, you're gonna take the sterile gauze in here, and this is gonna be used to help hold your art line for you. You're gonna take your CHG swab stick and you're gonna break it one time, and you're gonna let the CHG go into the pad. And then you're going to cleanse the site vigorously with back and forth motions. Remember that hashtag CHG. All around the site for about 30 seconds. And remember, we want to use vigorous back and forth motion. And always stabilize your line as you're doing this so you don't accidentally pull out your art line. Okay. Once your 30 seconds is up, you're going to allow it to dry fully. Remember, we don't want to fan it, we don't want to blow on it, and we don't want to dry any of that CHG off. We're going to let it dry. Since this is a fake patient, this is not actually going to dry, so we're just going to assume that it's dry. Then you're going to take your skin protectant pad here and open it, and then you're going to put your protectant all over the site where you're going to put your dressing, and that helps keep the skin protected from the adhesive. Once it dries, which you can tell it dries when your fingers start to get kind of sticky. So once that dries, which like I said, it's not gonna really dry on this pad, we're gonna take our dressing and we're gonna remove the backing. We're gonna put the CHG over the insertion site and kind of press down firmly to make sure it's all in place. And then you're gonna take off the wings. And remember, you wanna do the shirt, pants, and belt method. So there's our shirt. And this one didn't stick very well because of my pad. And you'll take the pants, you'll go underneath here, put it on here, and then you'll take your belt to go on top. That stabilizes everything out. And make sure you date and label your dressings. That's it.